Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barella. And today, as usual, we have a very interesting show. Perhaps a show that most of you don't think about a lot, because we're going to talk about infections, immunizations, and all things that infect our lives. And to do this, we have two special guests today. One is Janelle Linn, who is the lead nurse, at Navajo County Public Health Department. And with her today, we have Eli Bierman, who is a public health associate with the health department here in town. And I would say welcome to both of you.
Thank you.
Thanks.
Okay.
Great to be here.
So, infections are something that a lot of people don't think about. And it seems like every couple years we have you on, Janelle, to talk about the status of infections in our county, and we're going to talk about several issues today. And most people really don't think about infections, do they?
Not on a regular basis unless they're sick.
Unless they're sick. And that is the problem, isn't it?
It is.
Because a lot of what we do in medicine, or at least those of us that are in medicine and you as the public health nurse for the county, think about preventing infections.
Prevention and wellness, that's our focus.
Your prevention and wellness. Now, the problem with that is that most of us don't think in terms of prevention and wellness because we're all retroactive. When we get an infection, we run to the doctor rather than think about it. But infection prevention has been around for a long time. Mm-hmm. I mean, I think it's one of the reasons why we wash our hands and wash food, because I know we had Marshall Logman here on the show a while ago to talk about preventing getting infections from food, because that's been an issue in other areas of the country. I don't think it's been so much an issue in our county, is it?
We get occasional cases of neurovirus and different foodborne illnesses, but they're rare
in our county. Mm-hmm. But the things we're going to talk about are not particularly rare, are they?
No.
When we're going to talk a little bit about, we're going to start off the day talking about a really serious topic, essentially sexually transmitted diseases. Mm-hmm. And to do that, why don't we start off, and you indicated to me that Eli was going to give us a little bit of information, so let's start off with the simple ones. Talk a little bit about chlamydia.
Chlamydia, well...
where does it occur? I mean, what is chlamydia? I mean, I know it's an infection, but give us a little bit about the history of it.
So, like all of the STIs we'll be talking about today, sexually transmitted infections, they occur around sexual activity. That goes for chlamydia, it goes for gonorrhea, and syphilis as well. Particularly in Arizona, since 2000, we've seen cases of STIs such as chlamydia, gonorrhea, and syphilis triple. Since 2000. Mm-hmm. And between 2017 and 2018, in Navajo County alone, we stand with the third highest rate of chlamydia as well as syphilis, and the highest rates of gonorrhea in the state.
In the state. Mm-hmm. So this is a bad place to live if you have sexually transmitted diseases.
And when he's referring to rates, he's talking about the case counts per every 100,000.
So number of cases. So it's really related to the number of people that we have around here too. Mm-hmm. And these numbers, do they include the reservation, or are they just in the non-reservation population?
The numbers include the entirety of Navajo County. And one of the things that we have found concerning is we need to look at ourselves as an entire community. What happens on the reservation and off the reservation bleeds back and forth. A lot of healthcare providers treat both patients, and the reservation handles their own surveillance, and they're moving more and more in that direction. And Eli and I are handling the STI surveillance for the off-reservation cases, and there are enough of them that it is a full-time job for us. We spend a
full-time job just monitoring
it's a full-time job for
off-reservation.
Eli.
We stay very busy.
And I spend probably 25% of my time, and could be spending way more, on managing our STI infections, and we're handling the surveillance for off the reservation. Mm-hmm. So one of the things we're really wanting to stress is it's a community problem, and we need to look at ourselves as an entire community community and work together to solve and address the problem.
Okay, I think that's really an important issue. So essentially, all three of these are significant in our county, and we're at the top.
Yeah, I mean, it's a close race to which county leads.
One of those races I don't think we want to win.
No.
So let's go through. I mean, chlamydia is a sexually transmitted disease. Is it easily picked up by women and men?
Gonorrhea and chlamydia are easily, syphilis, all STIs are easy to become infected with. Women can be at more risk. They seem to contract STIs more easily than men based on their anatomy and differences in the anatomy. So it's very easy to contract, and 50% of the time you have no symptoms. So the only way you're going to know if you're infected is if you're being tested. Symptoms might include things, you might have some vaginal discharge, penile discharge, you may notice sores depending on the different types of STDs. However, like I said, 50% of the time you're not going to have symptoms, you're going to be asymptomatic.
So essentially for women, regular GYN exams at least yearly, I mean, whatever the recommendations are now, and certainly painful intercourse,
yes.
Any type of discharge that you can notice both for men and women, because
Burning.
men get urethral discharges also with STIs, although I think in men chlamydia is a lot more difficult to pick up.
Yes.
It is a lot more difficult to pick up. So, and we'll talk a little bit more about syphilis, because it's a little bit different in syphilis because of the way the disease goes. What happens if you think you have an STI? You can go to your doctor, but does the health department also have clinics to treat it?
You can schedule appointments in our Holbrook and in our Show Low office. Our Holbrook office, we have nursing services there on Mondays. When you come in for an appointment, you're going to meet with a nurse. You're going to do a sexual health history to help identify your risk factors. There's education involved. You're going to receive testing, and then there's a provider component with our STI testing as well. And if you come back positive, then we can provide treatment for gonorrhea, chlamydia, and syphilis.
Okay.
Those three are bacterial, and so they can be treated with antibiotics.
Okay, so that's important to know. And at least the tests for gonorrhea and chlamydia are really simple.
Right. Urine tests. For men who have sex with men, they recommend testing, oral testing, a penile swab, and urine testing. But for the general population, it's a simple urine test.
Okay, so for both populations, but it's simple.
Yes.
It's not
Very
like
simple.
having to get stuck with a needle.
It's not invasive. It's
Not invasive.
yeah.
Okay, so let's go on, and I know that a lot of the public is well aware of chlamydia and not so much gonorrhea, although gonorrhea has been an issue for treatment nationwide, only because of the developing resistance to the penicillins for gonorrhea.
So we become especially concerned with gonorrhea when we see people who keep becoming reinfected, which is fairly common because your risk of contracting or developing resistance to antibiotics is higher when you keep becoming reinfected and having to be treated over and over.
Okay, so we're going to talk about syphilis, and then I'm going to come back to you and ask, how do you think we can prevent this?
Okay.
Because I know that's a significant issue because you talked about prevention. So let's talk a little bit about syphilis. Eli, you're the one that seems to have the data. So how significant is syphilis?
Syphilis is significant. It's been a growing concern over the last few years. Talking with Janelle, I don't think the county saw a case of syphilis even 3-4 years ago.
I worked for the county for 19 years, and we were not having syphilis reported to us by private providers and laboratories or seeing it positives amongst our own patients that we test. Until 2016, we were basically at a 0 case count, and since then we have climbed to the 3rd highest rate in the state.
A distinction.
Yeah.
So until 2 years ago, syphilis was not a significant issue in our county, and now not only is it a significant issue for the infection, but one of the side effects of the infection is also significant.
Yeah.
So we're how many, I mean, it's obviously a significant issue. It's gone from 0 to a lot.
Yeah, so in the last 3 years, the rate has tripled in Navajo County. And in 2019 alone, up to this point, we've surpassed the number of syphilis cases seen throughout 2018.
Wow.
And that was as of July 30th.
So it's going to be even higher.
Yes.
Even higher this year. Okay.
And so, you know, everyone who's sexually active should, you know, get tested and you know, stay wary of sexually transmitted infections. But, you know, throughout the state, particular groups include, you know, young people, ages 16 to 24, men who have sex with men, and pregnant women should all be concerned and, you know, are what we call at-risk communities.
Okay, well, let's go on to pregnant women, because that's one of the potential side effects of this. And I know the state law changed a couple years ago requiring physicians to test pregnant women.
Yeah, so actually that's a good thing to kind of go off of.
Okay.
So what's unique about Navajo County and what we're seeing in Navajo County is a lot of heterosexual couples and people are coming into the doctor and testing positive for syphilis, and the concern there is that it opens up the risk of congenital syphilis, or an infection path between a mother and her baby.
Right, and the consequences of maternal syphilis, in other words, syphilis while they were pregnant, for the child is
Congenital syphilis.
Congenital syphilis is one of the side effects.
Can lead to miscarried pregnancies. It can lead to bone deformities in the baby, cognitive problems. I mean, even problems that develop decades.
Right, and so that's the real issue, is that if you don't pick it up at pregnancy, you have a miscarriage, and many times they don't test for miscarriages. Mm-hmm. I don't think the OBs particularly test for a miscarriage unless they were seen for the initial visit. And then if the baby is born, the baby doesn't have symptoms right at birth either.
Not always.
So if the mother hasn't been tested for syphilis at some time during pregnancy or at time of delivery, the baby can be born with syphilis, and then those things that you just mentioned can be develop in the children later in life. A very, very significant problem.
And we're concerned about it because the bulk of our cases are in individuals 25 to 40 years age. That's your childbearing population.
And not only that, we've had a significant number of children born in Navajo County in the last year that have been affected by
by congenital syphilis.
By congenital syphilis. I don't know if we have one child, I think, that was diagnosed later in childhood as having congenital syphilis. So a real problem, and for our audience, you know, not only when you go for routine gynecologic testing, but make sure that if you get pregnant that your doctor does all the serology and laboratory tests necessary to follow up.
They should be being tested at their very first OB appointment. They should be testing in the 3rd trimester and tested at delivery.
Okay, so 3 tests during pregnancy for syphilis, and then I know the OBs also do the gonorrhea and chlamydia tests at some time during the pregnancy. Well, that's certainly good advice for our audience. It's the younger audience. Well, us older people are at risk for it too. I read about it down in the valley that it's a significant issue among seniors also anymore. And
we've had some individuals infected in our community that are seniors.
Okay, so even in the White Mountains. So very, very excellent points along the way and stuff. And so let me finish with this particular topic, Janelle, and ask you how you can get prevention, because that's a big part of what the health department does.
One of the things we're really trying to stress is to destigmatize STIs. It's just a part of your health. When you go to your health provider for your annual wellness checkup, if you're sexually active, you should be receiving STI screening as part of your wellness exam. Normalize it. Just think of it as I go to the dentist twice a year to get my teeth cleaned. When I go to my annual wellness exam, I should ask for an STI screening. We're trying to educate providers to offer those to their patients, especially their high-risk patients. And if you are a high-risk individual who has multiple partners or other risk factors, you should be seeking out STI testing. And we're just trying really hard to normalize that conversation, to destigmatize, and to realize that we have to look out for our health. And we have to look out for the health of our children. You are able to receive testing at the health department and at your provider if you're an adolescent without parental consent for sexual health type services. And I think we need to work as parents. Our kids are going to go eat too much Halloween candy if we don't rein them in, but we need to be doing, some of these things too, and having these conversations with our kids and arming them with knowledge so that if they do make choices that lead in that direction, they know where they can receive a screening or get help and information.
Well, that's important for people to know that they can come to the health department, and it really can be anonymous since you don't need parental
it's
approval.
Not anonymous, but it's completely confidential.
Confidential, I'm sorry, because there are some consequences. If you're positive, then you have to do some follow-up. But it's important that if a young person wants to be tested, they can come to the health department, because a lot of times it's difficult to go to your doctor because the doctors always charge your insurance, and your parents, that's been an issue. So, a couple years ago we talked about this, and it wasn't a big issue, but I seem to think a couple years ago when we talked about it, we were just at the beginning of this, and we didn't know whether it was going to go this way or go like this and not increase. And at that time we had the discussion that at least in Europe the treatment for this and prevention has been education and intensive education, starting at least in children early or in childhood than we think normally in the United States. And I know sex education is always an issue for parents, and it's always a sensitive issue for all of us that have piles of kids running around, because it is a tough discussion to have.
One of the things we really stress with parents and with the education that we provide ourselves is not to look at it as sex ed, but to look at it as making wise choices. If you're making wise choices, you're reducing your risk factors. And so we work a lot with our youth on life planning, and it involves everything from their educational goals to overall health in general, which the reproductive system and sexual health is just a piece of our overall health. And so we really stress, let's not focus on sex ed, let's focus on wise decision making and life planning and knowing the resources in your community to be as healthy mentally, physically, spiritually as possible.
I like that concept that it's really more than sex education. It really is health education, and sex is part of health, and that part of your body requires just as much attention as other parts of the body do. That is a nice approach, and good thing, huh? Do you have any other information to offer for us, Eli? I know Janelle is really pretty comprehensive, and you had the data there.
Yeah, well, I was hoping to include some links to, say, our community health improvement plan and community health assessment, basically a large overview of health and health issues in Navajo County and what we're trying to do to address them, which includes sexually transmitted diseases.
A link, mean computer link?
A computer link, that's something like that. We also have a new, it's called a data dashboard, and basically it takes all of the data and it boils it down to a brief, easy to read and understand overview of what's happening with STIs in Navajo County.
Okay. Well, let's leave STIs for a second here. Okay. we may come back to STIs, although it's always a very difficult topic to do. There's two other things that I would like to talk about today. One of them is influenza. and the other one is HPV.
Okay.
Okay, so let's go next to influenza. We're taping this show at the beginning of winter, and flu is always an interesting topic.
It is. And now is the perfect time to get your flu shot.
Okay.
The CDC and APIC recommend that you get your flu shots in October. Arizona typically lags a little behind the rest of the nation in our flu season, so end of October, November is the perfect time to get your flu shot here. If you haven't gotten your flu shot, get it. They have added a new strain to the flu vaccine this year, a Kansas strain. The last several years, bee flu has not been highly circulating. At the end of the flu season last year, it kind of raised its head, so they're expecting maybe some heavy influenza type B cases this year, and they feel like the strain that they've included in the vaccine to protect against the B strain is going to be highly effective.
Okay, so there are two real strains, influenza A and influenza B,
right.
And the difference between them is?
Well, they're just different viruses, different strains, types of the flu.
You hear about influenza A being the more virulent or the more severe of the two strains of virus, and I know influenza B typically has been more of a spring type of virus than the influenza A. And when does
last year we saw a lot of co-infections where a lot of the patients had both A and B, and they were very ill.
Yeah, and that's really unusual to get two infections at the same time, and stuff. And so when is the peak season for influenza? We talked about B, but when A, being the one that you read about mostly in the newspapers, is the worst time of the year for that is?
Typically late fall, or I'm sorry, like late winter moving into the first part of the next year. But like I said, that's the national average. In Arizona, we typically tend to lag 1-2 months behind, so typically January and February are our peak
months.
Flu seasons.
Okay, so I know this year, which is the only places they've had influenza so far have been in Louisiana and in Hawaii, and so no winter trips to Hawaii for anybody in the office unless you've had your flu vaccine. So there are vaccines, and there's more than one type of vaccine. Right. Do you?
Well, there's quadrivalent vaccines, and that's the recommendation now. So the vaccine contains 4 different strains of flu virus. They follow that and assess that all year, and CDC and a bunch of important people, World Health Organization, they get together and decide what strains should be included in the vaccine for next year. So.
And I know that there's a super powerful vaccine for us old people, but it is not quadrivalent. My understanding is it's a trivalent, and I guess the vaccine that's missing in the trivalent booster shot for us old people is missing one of the B strains rather than the 2 types of A strain. So I think it's important for people to know, us old people all remember that when you used to get sick from your flu vaccine, and I've always tried to tell people that does not happen now that we have a killed vaccine, that you don't get flu from it anymore since I think it was 1996 or 98 when we switched over to a fully killed vaccine. And I always like to talk about how serious of an illness flu is.
A lot of people don't understand what the flu is. They think if they get a stomach virus and they have vomiting and diarrhea, they've got the flu. They think if they get a cough, they've got the flu. That's not what the shot's protecting. The flu shot is protecting against influenza, and it makes you seriously ill, and their mortality rate for influenza nationwide is about 30,000 people a year. It kills people. You're very sick. I had it once. I get my flu shot every year now.
Well, as a physician, I've always gotten my flu shot, even in the years before we had it, and it's interesting. It's particularly devastating in young children and, of course, old people. And you quote 30,000. I always think of it at least as 60,000, and some years over 100,000 people dying in the United States. And of course, most of us weren't around in the 2000s or 1917 epidemic that killed millions and stuff like that. So one more illness I want to talk about, which is HPV, human papillomavirus, because that immunization in my mind, is one of the most important immunizations that any female could ever get.
And male.
And male.
They're broadening all the time the types of cancers that it protects against. And it started, you know, cervical cancer. They're realizing it protects against penile cancers, anal cancers, and it's a highly effective vaccine. A lot of the parents in our area are concerned about vaccinating their kids because we start vaccinating at like the 9 to 13-year-old age group. And they're like, well, why? They're looking at it as a sexually related vaccine. And I think we need to change our mindset and look at it as a cancer preventative vaccine. Cancer's awful. This vaccine's effective. It has very few side effects. We've given thousands of doses. The worst, you know, we've had callback is I got a sore arm. That's normal. When you get a vaccine, it causes a sore arm a lot of the time. It's your body surmounting an immune response. It's a good thing. It means it's working. So we really want to encourage parents to get this vaccine and really look at it as a cancer preventative vaccine, and it's highly effective. And if you can complete the series before you become sexually active, it's more effective. That's why we start vaccinating in that 9 to 13-year-old age group.
And we're out of time, and I'm going to thank the two of you for coming today.
Thank you.
It's been an absolutely wonderful discussion, and I enjoy this every couple of years to do that. And for those of you that have viewed today, a couple of things to think about. Routine screening for STIs, get your flu shot. Get your flu shot. And those of you that have young children, that the HPV vaccine is not a sexual vaccine. It is a health vaccine that is incredibly successful at preventing cervical cancer and helpful in preventing penile cancer. And thank you very much for watching, and stay healthy.